ready to move on to the exercises where you're going to need the firm surface, an exercise mat on the floor if you're able to get up off the floor, or a firm mattress at home. You're also going to want to have the strap or the belt that we talked about earlier to wrap around your foot to assist with some of the exercises, and the towel roll that's approximately 6 inches in diameter. The first one we're going to do is called a quad set. And what you're going to do is you're going to extend your leg out with your leg fully supported on the mat or the bed. And you're going to tighten the muscles on your thigh by squeezing and pressing down. You're going to hold that for 5 seconds. So it's hold, 2, 3, 4, 5, relax. When you press down, you're going to feel the back surface of your knee pushing down into the mat or the bed. Again, I'm going to show you 3 repetitions, but you're going to do 10 to 15 reps twice a day. So tighten that thigh up, hold it for 5 seconds, hold, 2, 3, 4, 5, relax. And again, hold, 2, 3, 4, 5, relax. It is okay if you're comfortable doing it to do both legs at one time also. The next exercise that we're going to do are called gluteal sets. You may use your foam or your towel roll, a foam roll, or a little pillow for underneath your head when you lay down. So you're going to lay down with your legs extended, and you're just going to tighten your hip muscles or your gluteal muscles. You're going to squeeze, and you're going to hold again for 5 seconds. Hold, 2, 3, 4, 5, relax. And again, squeeze and hold, 2, 3, 4, 5, relax. And again, squeeze, hold, 2, 3, 4, 5, relax. It's important to know that you can do the glute squeezes sitting in a chair as well. That's okay. All right, the next one we're going to do is called a heel slide, and you may need to use the strap on your foot. If you're going to have surgery on your left knee or your left hip, you may need to put that strap around the foot to help you move the leg. And the exercise works like this. You're going to go ahead, and I would probably bend the other knee to support your low back. And what you're going to do is you're going to slowly, you can actually lay down to do this, it's more comfortable. So you can slowly lay back, and you're going to use the strap to slide that heel up towards you, bending the knee as far as is comfortable. Then you're going to slide the heel back down. If you find that your foot is sticking because you have a shoe on, feel free to take the shoe off and do it in a sock. Again, you're going to slide that foot up, bending as far as is comfortable, and then push it back down. And again, slide it up and push it back down. When you're finished with the heel slide, what you're going to do is you're going to do something called a short arc quad. So a short arc quad is you're going to require your little towel roll. You could also take a small pillow and fold it. You're going to put it under the knee or the leg that you're going to have the surgery on. And you're going to lean back a bit, and you're going to just lift your lower leg up, tightening the thigh muscles, and again, holding for 5 seconds. So it's hold, 2, 3, 4, 5, and then lower the leg down. Again, tighten your thigh, lift the leg, hold, 2, 3, 4, 5, and down. And lift, hold, 2, 3, 4, 5, and down. Again, you're going to complete 10 to 15 repetitions of this. Okay, The next exercise is called a straight leg raise. So the straight leg raise, you may want to use your towel roll again as a pillow. You will possibly need to use the strap again around the leg that you're going to have surgery on. You're going to bend your opposite knee and put it flat on the bed or the mat. You're going to go ahead and lay back. And then you're going to tighten your abdominal muscles. And you're going to go ahead and lift the leg. Now, if you're able to lift it without using the strap, that's wonderful. If not, you can go ahead and use your hand to lift the leg a bit. You're going to hold it up, and you're going to count for 5 seconds. Again, hold, 2, 3, 4, 5, and lower it slowly. Don't drop it. You're going to do it again. You're going to tighten your thigh, lift it, hold it, 2, 3, 4, 5, lower it down, and again, tighten the thigh and lift, hold it, 2, 3, 4, 5, and down. Okay. Alrighty. When you're done with the straight leg raise, we're going to do a knee extension stretch. If this is uncomfortable, you might want to use a little bit smaller towel roll, but we're going to try to use the approximately 6-inch diameter towel roll. You're going to place it underneath the ankle of the leg that you're going to have surgery on. You're going to bend your opposite leg, and you are just going to lay down, and you're going to hold that position for 10 to 15 minutes. So we're not going to do 10 to 15 reps. We're just going to do 1 repetition of laying down like this. Try to relax. Just breathe and let the muscles on your thigh relax so that that knee can stretch out. Okay. When you're done with that one, the last one is going to require the strap again. It's called hip abduction. So you're going to go ahead and put the strap around the foot of the leg that you're going to have surgery on. And you're going to go ahead and lay back again. You're going to bend your opposite knee for support again. Tighten your abdominal muscles. And you're going to lift the leg out to the side and back in. Again, if you're going to have surgery on that leg, that may be difficult. That's why you can use the strap. If you're able to do it without, that is perfectly fine. There is no hold to this exercise. You're just going to move it out and in. One more time, out to the side and back in. I do want to let you know that all of these exercises are beneficial if you do them both on the operative leg and the non-operative leg as well. So that concludes our exercise portion of the preoperative education seminar for total hip and total knee replacement. Have a great day.